All right, so let's talk about some possible side effects of epidurals. The extent of pain relief can vary from total relief to absolutely no relief at all. So I encourage, like I said, all women to have some coping techniques and skills to pull out in case this ends up being your story. Approximately 85% of women get total relief from blocks, and others experience only partial relief, and some no relief at all. So there's my plug again for that mindful childbirth class. It's important to have, tricks in the bag that you can pull out to help you breathe and visualize and relax during labor so you can have the best experience possible and you feel like you're still in control of your labor and your birth. A slight drop in blood pressure is probably one of the most common side effects of an epidural. Your blood pressure will be closely monitored and you will receive continuous administrations of IV fluids to help minimize this risk of a drop in blood pressure. If the membrane that confines the spinal fluid is punctured with the needle or catheter, a higher than optimum amount of anesthetic might be absorbed, and this can also result in a post-spinal headache after birth. So you can also see epidural anesthesia can slow labor, especially if it's given too soon. In addition, epidurals may also hinder pushing efforts. However, at other times it may also allow labor to proceed faster than usual, which is obviously typically a welcome side effect. There's just really no way to tell what it's going to do with your labor. As a general rule of thumb, you're going to want to wait to receive your epidural until your healthcare provider has recommended that you're far enough along in your labor that it won't stall. Adverse side effects on the central nervous system include lightheadedness, ringing in the ears, speech and visual difficulty, numbing of the tongue, and loss of consciousness can follow the accidental injection of the agent into a vein. And this is actually usually avoided by a test dose before a larger administration, but I think it's important to know the side effects of the epidural so you can fully research if that's the way you want to go or not. Okay, like I said, we were gonna cover a spinal block. So a spinal block can provide pain relief for up to 2 hours. It's might be the choice of anesthesia for a cesarean birth, depends on the provider, and provides pain relief in the lower abdomen, legs, and birth canal. Okay, so let's move on to induced labor. So some medical reasons for inducing labor might include diabetes, high blood pressure, Rh disease, post-dated pregnancy, ruptured membranes, that means your water is already broken, or small for dates pregnancy. And with ruptured membranes, once your water breaks, if labor doesn't start, that's when they would induce or augment labor with Pitocin. Okay, and so now we're moving to ripening of the cervix. Normally, prostaglandins will start this ripening process. So that means shortening, softening, and dilating of the cervix in a painless fashion in the last few weeks of pregnancy. In some women, though, the cervix stays long and thick, especially a first-time mom. If your healthcare provider feels that an induction is necessary and the cervix is not ripe, you may receive a suppository that is placed in the vagina. These suppositories contain prostaglandins and assist in the preparation of the cervix for induction. So this is Cervidil that you see up there. Another way your healthcare provider may ripen your cervix is by inserting a rubber tube with a balloon on the end into the cervix, and then the balloon is then filled with air or water. And then you can see in our graphic here, I just wanted to show kind of a fun way what 10 centimeters of cervical dilation looks like, and this isn't to scare you, but it's just to kind of give you an idea of what happens to that cervix during delivery so that baby can actually fit through the birth canal. All right, so let's talk about Pitocin. Pitocin is the medication used to either start contractions or speed up labor. It stimulates the uterus to contract. It's controlled by an IV pump. So as you can see there, we've got an IV bag and that's hooked up to mama. And if you're going to be using Pitocin, you must be on a continuous fetal heart rate monitor. This is because Pitocin contractions are artificially induced, so they can be stronger and therefore harder on the baby. So we want to make sure that we're monitoring baby, that the baby is tolerating those contractions well. If baby isn't tolerating the contractions as well as we hoped, then the Pitocin drip might be turned down. If they're doing great, the Pitocin drip might be turned up. And this is all gauged by your nurse and your healthcare provider. Okay, so further on in induction, we consider artificial rupture of membranes. So as part of the induction, your healthcare provider may artificially rupture your membranes to help start labor. As you can see, an instrument is inserted in the cervical canal to rupture the membranes. This shouldn't hurt. It's similar to a vaginal exam, so it can just be slightly uncomfortable. And then, of course, you're going to feel like you just peed your pants because you'll have a gush or a trickle of warm fluid coming out. The fluid is generally clear to straw-colored, but on occasion may contain meconium, which is the baby's first stool. If the fluid is meconium-stained, special attention may be focused on your baby immediately following the birth to help prevent lung problems that can result from the baby aspirating or breathing in meconium in the fluid. Alright, so let's move on to breathing techniques. In the next video, we talk about a couple of breathing techniques that are really great to pull out during labor, in between those contractions, and then also a breathing technique for during those contractions. Let's get started. Hey guys, in today's video, we're going to be talking about breathing techniques. So the first technique that I want to talk about is a contraction or surge breathing technique. Now, contractions can be really intense, so with this breathing technique, it's just a way to put power in your breath. It's a more intense breathing technique to help you get through the intense contraction. So the way this breathing technique works is you'll count mentally in your mind up to 10 or whatever number you decide you want to do. We're going to do the same number on the in breath and on the out. So we're going to practice it now, and if you want, you can do it with me. So it's in for 10, out for 10, and it's a quick 10. So I'll practice it now. Ready? So again, it's okay, great job. So let's move on to our next breathing technique. This breathing technique is called square breathing. With this technique, all you have to remember is the number 4. This technique is a great technique to pull out on a stressful day to just help recenter and refocus and bring that calmness to your life. And it's also a great technique to use in between contractions to help you to relax and get ready for that next contraction. So with this technique, we breathe in for 4, hold for 4, breathe out for 4, hold for 4. I'm going to do this now. You're welcome to do it with me. So it's and then breathe out. Okay, and then that's our square breathing technique. Let's move on to our next breathing technique. This technique is probably one of my favorites. For me, it just helps me feel super relaxed. It's just a slow breathing technique. It's one that's really great to pull out in between those contractions. The purpose of this technique is to help you not to hyperventilate during labor. Your uterus uses a lot of oxygen during those contractions, and so we just need to be really mindful that we're replacing that oxygen with our breath and that we're allowing our bodies to fully relax in between those contractions so that our uterine muscles can work in harmony as they should during those contractions. And I actually have a video that's all about the uterine muscles and how they work during labor. So if you're interested in that, you're going to want to check that out for sure. So this slow breathing, you breathe in for 4 and then out for 8. We'll practice it right now, so if you want to do it along with me, we'll just go ahead. So we go and then out for 8. And then you just feel all the stress and tension melts away and let your body totally relax. Should we do it one more time? Let's do it. So we breathe in for 4. So those are some great breathing techniques to pull out. Like I said, we have the specific breathing technique for during contractions, and then slow breathing and the square breathing that help in between contractions. So thanks for watching our breathing techniques. And there we have it. There's week 3 for you. We'll move on to week 4, which will be taught by Julie. If you have any questions, up until this point, feel free to email me and we will cover those questions. And I'll provide the link to the email for these questions at the end of the class.